Hey, what's up everyone? Ting here, physical therapist at Physical Therapy Balance Centers. And today what I want to show you are the 6 best exercises you can possibly do to help with your shoulder pain, especially if you have a condition like a subacromial impingement. Conditions that fit under that include rotator cuff tendonitis, tendinosis, or if you have bursitis, or if you even have rotator cuff tears. So the reason these 6 exercises are the best ones you can do was because they were found in a study to help people with subacromial impingement that had already scheduled to get surgery on their shoulder. After doing these exercises for 12 weeks, 80% of them took themselves off a surgical wait list because they were feeling better. So all you need for these exercises are a couple of little pieces of equipment. For one, we're going to use a TheraBand. 2, we're going to use a light dumbbell. If you have something like that at your house, grab them and we'll show you what to do next. Alright, so exercise number 1 is to target the external rotators of the shoulder, and with this exercise you only want what we call the eccentric aspect of the exercise because that's been found to be better for the rotator cuff tendons. So all I've got here is a TheraBand. I tied it to a post here at about elbow height, and the external rotators of the shoulder works your arm from this position to that position there. But we only want the eccentric, which is the return. So you don't want that motion, you just want this motion coming back in. So what I'm going to do is I'm going to use my uninjured shoulder, pull the band out, hold it in that position, hold it still, and then very slowly allow it to come back to my belly. And then once I get there, I don't want to pull out, I want to use this arm to pull it out, get the tension on again, and then very slowly allow it to come back. Okay, so what we're aiming for is a set of 15, nice and slow, and if it's not painful, the aim is 3 sets. And according to this study, you don't want your pain level to go up above a 5 out of 10 on a pain scale. A little bit of soreness is okay, but if your pain level gets above a 5 out of 10, stop at that point and move on to the next exercise. So exercise number 1 is eccentric external rotation. Okay, so exercise number 2 is we're going to target the supraspinatus tendon, which is another one of the rotator cuff muscles. The role of the supraspinatus is to move your arm from this position by your side to around about 30-40 degrees of abduction or out to the side. So what we want again is the eccentric or the return. We don't want the actual movement out. And using a band again, when you do this exercise, make sure your palm is facing forward and not facing towards you, because if you're doing it this way, that actually causes impingement of the rotator cuff itself. So make sure you do it with your palm facing forward, thumb going out. So what I'm going to do is grab onto the band, use my uninjured hand to pull that band out, get it nice and contracted in that position, and very slowly bring it back into the side again. So I don't want the pulling out, I'm going to use my other hand to do that. I'm loading the shoulder and allowing to come back in through to the side. Make sure that you have nice, good, tall posture as well, because if you have rounded shoulders, that adds to the shoulder pain and the possible impingement as well. Similar to the previous exercise, you want to shoot for about 15 and 3 sets if it's not painful. And if your pain gets above a 5 out of 10, make sure you stop and move on to the next one. So exercise number 3 is what we call a bent row. So what you want is like about a medium-sized weight. I have 15 pounds here. You don't want anything too heavy that you're struggling to lift, and you don't want anything too light because you're not going to get any strengthening at that stage. So the bent row, a couple of key things you want to look for is you want your body parallel to the ground. Make sure you're not in that position because there you're going to create more strain in the shoulder. So make sure you're bent over, completely parallel to the ground, and make sure your back is stable. And when you lift the weight, you want to make sure that your shoulder blade comes up with your arm as well. Okay, so that shoulder blade should lift back like that. What you don't want to do is leave the shoulder blade there and just pull the elbow back. That's not going to be good for your shoulder at all. So nice, smooth, bent rows there. What you're after is sets of 15 again. Try for 3 sets. And remembering that pain score should not go above a 5 out of 10 on a pain scale. Exercise number 4 is a exercise to target the serratus anterior muscle, which is the ones that you see on the body lifters that stick out on the side. And for that one, we're going to do what we call a shoulder protraction. So we're going to use the same weight. This time we're going to have our back parallel to the floor. And the motion that we're after is from this position to that position there. So it's a very small movement. What you're after is that shoulder blade moving up and down like that. If you want to get a little bit more of a strengthening workout for your arm, you can let your whole body come down like a bench press, come on back up, but once you get to that position, you want to do the extra pulse there. So the key with the serratus anterior is to get that little pulse at the end. Again, aiming for 3 sets of 15, and always remember that 5 out of 10 pain score. Okay, so exercise number 6, we're going to target our lower trapezius, which is important in allowing our shoulder blades to rotate backwards. So for this one, we're going back to the TheraBands, and if you're at home and you don't have access to a lat pull down machine, what you can do is tie the TheraBands off to like a high railing of some sort if you have stairs, or you can wrap it around the top of the door and kneel down to get this exercise in. So basically what we're after is this motion right there, and the shoulder blades again should be coming back and down. So we're going to do sets of 15 again, the shoulder blade pulling back and down, and make sure that the shoulder blades squeeze in the back as well. So what you don't want to do is one of these. And get those shoulder blades back, nice slow movements, and you want sort of like a medium resistance if you can. Aiming as always for 3 sets of 15. And as always, if that pain score gets above 5 out of 10, make sure you stop, get on to the next exercise. Be sure to get some nice squeezing at the end there. So the final exercise is a posterior capsule stretch. And what we found is that people with shoulder problems, including impingement and rotator cuff injuries, the structures in the back of the shoulder tend to get very, very tight. So this will address that. So the best way to do this is to be on your side, and I'm going to lay down on the ground here. So you're going to lay down and then roll slightly towards the side that's injured. Your arm's going to be about 30 to 45 degrees out into abduction, and then make sure your shoulder blade stays on the table. And in this position, you want your arm to just drop into an internal rotation here. And as it drops in, you should feel a nice little stretch in the back of the shoulder here. So you can use this hand to give it a little bit of over pressure if you want. But remembering the pain score shouldn't be anything above a 5 out of 10 in the pain scale. And the ideal amount of time to hold this exercise for is about 30 to 60 seconds. Maybe start off at 30 seconds, and if you find it's not too bad, you can build up to 60 seconds. And this one you only have to do a couple of times each session, and it shouldn't be any pain with this. Some tightness is okay. Alright, so those are the top 6 exercises you can do for your shoulder pain, especially if you have subacromial impingement, rotator cuff tendonitis or tendinosis, or bursitis, or even torn muscles in your rotator cuff. So a lot of the research points out that by doing these exercises for 12 weeks, it can actually reduce your risk of having surgery by up to 80%, which is great. So try some of these exercises at home, remembering the pain scale should not be above a 5 out of 10. And if you're not 100% sure about them, be sure to call your physical therapist first. Get in for a consult, because they can sit there and help you with these exercises to make sure that you're doing them properly. And if you have too much pain, they can do a bunch of things to try and help reduce the pain so that you can make the exercises more comfortable. So if you are going to do them though, the recommendations are to do them twice a day. And remember, sometimes it takes a while for them to kick in. So the programs that we talk about in terms of the research went for 12 weeks. So hopefully this will be able to help you out as well.